Hey everybody, it's Dr. Jono from Gluck Orthodontics in Nashville, Tennessee, and today I want to show you a case that we completed which I think has a couple really interesting teaching points talking about what are the things that the orthodontist looks at when you go in for a consultation, what are kind of the areas of focus, things that they're going to make a diagnosis off of, and then I also want to talk you through the way that we approach the treatment, how we got to the end result, so it should be really interesting. Let's take a look. Okay, let's take a look at this case, and what we're going to do is start with some clinical photographs. And what you see here on the left is our standard frontal smiling photo, and this is used to assess things like facial proportions in terms of width and height, symmetry from the teeth, and the other facial features. From here, we'll look inside, and you can see we have two photos here, although usually we're going to take about 8. These are going to demonstrate things like up and down overbite. How much do these top front teeth cover the bottom? Forward, backward overbite. How much do these bottom front teeth come back relative to the top? We'll look at the bite on the side. Where do these canine teeth fit relative to the bottom? And again, the goal of this overall is to create a list of things that help us formulate a diagnosis, because that's really the foundation for deciding what's going to be the best treatment option for the patient. After we've taken photos, what we'll probably go with next are X-rays, and this is going to be the most common. It's what we call a panoramic X-ray, or you might also have heard of it as a pan or a Panorex. And this shows all of the teeth. It's going to show us the jaw joints, and what we're looking at is how are the roots of the teeth? Are all the adult teeth there? Are they all where they belong? Is there anything going on in terms of infection or issues at the bottom of the roots of the teeth? Where are the wisdom teeth relative to the 12-year molars? Are they developing at the right place? Do we feel like there's going to be enough room for them to come in? We're going to look at the angle of the roots of the teeth relative to each other. So if you look at this side, you can see these are all nice and straight up and down and parallel. But if we look at this one, it's kind of tipped in a little bit towards the side. So we'll take a note of all of those things. And then, like I said, we'll also look at the jaw joints in the back, which are here, making sure those are normal size and shape and the anatomy is as it should be and there's no issues going on. So the next tool in the orthodontist toolkit will be this cephalometric X-ray, also known as a Ceph. And this is a side X-ray which shows the relationship of the upper and lower jaw relative to the rest of the face. It shows the angle of the upper and lower front teeth relative to the upper and lower jaw. It shows the position of the upper and lower back teeth relative to each other. It also helps us diagnose vertical proportions of the face. So that would be the mid face and the lower face. Again, all of this is combined with the other data that we've gathered from the panoramic X-ray, the clinical photographs, and the clinical examination to formulate a complete diagnosis before we move into developing treatment options and a final treatment plan. Okay, here we go. So we decided to treat this case with Invisalign. What you're looking at is a screenshot of Invisalign software, which we call ClinCheck. And let's just look at the case one more time and I'll kind of show you the issues. So we've already talked about some up and down overbite. If I tip the teeth up, you can see really that forward backward overbite, how those top teeth kind of stick out relative to the bottom, and the bottom are kind of tucked in underneath the top ones. You can see that we have the bite is off where the top ones are ahead of the bottom ones. If we look back underneath, you can see we have some crowding where the top teeth have been kind of pushed together, not perfectly straight, and same thing on the bottom. And so what I'm going to do is play the treatment plan from start to finish, and you'll see a couple of things. So as we go through this, the first thing you'll probably notice is the top and bottom front teeth kind of separating or moving apart. That is what we call overbite correction, which takes that up and down overbite from 100%, if you remember from before, to something that we would prefer a little bit less, right? If you look from the front though, or from the side, I'm sorry, you can see that we still have that forward backward overbite, and I'll show you how we handle that in just a second. So let's go back and we'll look at the top teeth, and you can see that we've prescribed some movements to straighten the teeth. We're also narrowing these back teeth and kind of rounding out the arch form or the shape. And if we look at the bottom, same thing. We've gone in and we've straightened the teeth. We're changing the shape of the back, and that's what we call arch form coordination, where we're really assessing or changing the shape of that arch so that the top and bottom will fit together properly. And so what you're looking at right now, we're at aligner stage number 28, is straight teeth. We have the up and down overbite fixed, but that forward backward overbite is not fixed. And so as I go from stage 28 to 29, you'll see in one stage the bite changes. That's what we call a bite jump, which the way that happens is the patient wears rubber bands. And so what I'll do is I'm going to turn the attachments on, which we have another video, if you look at our YouTube, kind of describes what attachments are. And what you see here is these blue things, these blue lines are hooks that are manufactured into the aligner, and then the blue circle is actually a little cutout. It almost looks like you took a hole punch and you punched a hole in the bottom aligner, and when the patient comes in, we'll glue a little button on that area right there. And so the rubber band runs from the top to the bottom in this diagonal fashion, and as the patient wears the rubber band, you can see how it helps to shift the teeth. And now, this bite jump is not necessarily how the teeth will move, it just represents that change. And so what we would probably have with the rubber bands is some combination of the top teeth going back and the bottom teeth going forward to really split the difference and help us get that overbite corrected. So this ultimately was how we decided to set up the treatment plan. We went through a couple of different options, but the reason why we had it like this was, again, going back to it, based on that diagnosis, which teeth we felt like needed to move and where we thought they needed to move to really get the result that we wanted. After 28 aligners, changing every 2 weeks, so about 56 weeks of treatment, a little bit over a year, this is what things looked like when we were finished. Now, this guy was an absolutely amazing Invisalign patient, wore his aligners all the time, wore his rubber bands all the time, and that's why he got such an amazing result. We did a good job of getting the up and down overbite fixed, forward backward overbite fixed. We got nice teeth with a really handsome smile and a fantastic bite. Now, the case is great, but the overall take-home message from this video really is to teach and to kind of demonstrate, what an orthodontic specialist is looking for and what they should do when you go in for a consultation in terms of taking clinical diagnostic records, pictures, x-rays, maybe a digital impression, and really going through and assessing the aesthetics, the function, the bite, the gums, all that kind of stuff. And all of that is put together to formulate a diagnosis, which is the foundation for devising treatment options, which we can then present to the patient, work together to come up with the best possible treatment plan going forward. So I hope you guys learned a lot. If anybody has questions, please reach out to us anytime. AskDrGluck@gmail.com. We'll probably do some more of these. If you guys like it, please give us a like or a shout out or a comment. Visit us online, drgluck.com, and we hope you have a great day.